hyperthyroidism, that's the overproduction of the hormone thyroxine by the thyroid gland. It accelerates the body metabolism, which leads to weight loss, irregular heartbeats, sweating, and nervousness. Some treatment can be like anti-thyroid medications. Sometimes using of anti-thyroid medications can lead to hypothyroidism because of it causes the gland to shrink, so it leads to hypothyroidism. And then we have surgery removal of the thyroid gland. The causes Graves' disease. That's when the autoimmune, is an autoimmune disorder in which the antibodies produced by your immune system stimulate your thyroid to produce too much thyroxine 4. And then we have hyperfunctioning of the thyroid nodules. That's when one or more adenomas of your thyroid produce too much thyroxine 4. And then we have thyroiditis. That's the inflammation of the thyroid glands, which leads to excess thyroid hormones stored in the gland to leak into the bloodstream.
Okay. Signs and symptoms of hyperthyroidism would include increased heart rate, palpitations, dyspnea on mild exertion, weight loss, warm but smooth moist skin, fine hair, heat intolerance, nervousness, goiter felt upon palpitation, bruits on auscultation of the thyroid gland, and exophthalmos, which is the buildup of fat causing pressure and fluid deposits from the orbit. Diagnostic tests would include the T3, T4 test, measured in the blood, the radioactive iodine uptake, ECG, ultrasound, thyroid scan, antibody assay, and TRH stimulation.
And then you have interventions. Interventions for hyperthyroidism include monitoring, comfort, reducing stimulation, and drug therapy. So we're monitoring the blood pressure and heart rate and temperature. Because of course our outcome is to get everything at a normal, within normal limits. Reducing stimulation, so you make sure that the patient is not stimulated, turn the lights down, plan care so that you don't have to constantly work with the patient and get them, irritated. You can reduce their stress as well as limit their visitors so that they're not getting too much stimulation. Keep them relaxed and calm. Comfort, keeping them comfortable. And the drug therapy. So the drug therapy is to maintain their cardiac function as well as reducing the hormone stimulation.
So now hypothyroidism causes.
Okay. Hyperthyroidism, that's a condition in which the thyroid gland does not produce enough thyroid hormones. It's mostly common in women, and then it happens when, as a result of that, the thyroid doesn't produce enough hormones, which affects the balance of the chemical reactions in the body. And then the causes are autoimmune disease. There's a condition that's called Hashimoto's thyroiditis. That's when it causes like the autoimmune system produces antibodies that attack itself. And then we have treatment for hyperthyroidism, as I said earlier, that it leads to hypothyroidism. And then we have radiation therapy. That's when you are treating cancers. Sometimes, when treating cancers of the head and the neck, it sometimes affects the thyroid gland. And then we have medications like lithium, which is used for psychiatric treatments, sometimes it affects the thyroid, thyroid glands, and then we have is it levotroid and centroid, it's to restore adequate hormone levels.
Okay, so what differentiates the symptoms of hypothyroidism from the natural aging process? Obviously, as you get older, your metabolic rate decreases, and many people experience weight gain and fatigue. But these may also be early indicators of thyroid dysfunction. Symptoms of hypothyroidism have a gradual onset, making it more likely for a patient to contribute symptoms to the fact that they're getting older. But in some cases, patients insist that they have thyroid disorder because they're gaining weight, but all they eat for breakfast, lunch, and dinner is donuts. They don't exercise. The presence of a decreased heart rate beyond what's naturally expected, so less than 60 beats per minute, and a goiter in the thyroid area, may push providers to believe that the fatigue is related to hypothyroidism and not the fact that you haven't exercised in 6 months. If thyroid dysfunction is left untreated, more noticeable signs and symptoms can occur, including coarse features, swelling around the eyes, a thick tongue, slow muscle movements, and decreased cardiac and respiratory functions. When lab work is done, it will reveal a low T3 and T4 with an increased TSH. Continuous untreatment can lead to myxedema coma, which is not a normal aging process. If there's no treatment for getting older, patients with hypothyroidism can be treated with thyroid replacement hormones, which when titrated to the right dose will allow them to continue getting older and fatter at a normal rate. So to compare and contrast hyper and hypothyroidism. Hyperthyroidism is an excessive thyroid hormone secretion, where hypothyroidism is low levels of thyroid hormones. Hyperthyroidism is a hypermetabolism that results in increased heart rate, stroke volume, cardiac output, systolic blood pressure, while hypothyroidism leads to a decreased metabolic rate with decreased cardiac functions. People with hypothyroidism are always cold and constantly fatigued, whereas people with hyperthyroidism cannot tolerate heat and may have difficulty sleeping. Patients with hyperthyroidism have unexplained weight loss, while patients with hypothyroidism have unexplained weight gain. Hyperthyroidism may be caused by Graves' disease, which is an autoimmune disease resulting in the overproduction of thyroid hormone, whereas hypothyroidism may be caused by a decrease in thyroid tissue, synthesis of thyroid hormone, or a decrease in TSH. Hyperthyroidism is treated with anti-thyroid hormones, radioactive iodine therapy, or surgical removal of the thyroid. Hypothyroidism is treated with thyroid replacement medications. Monitor patients with hyperthyroidism for thyroid storm, and monitor hypothyroid patients for myxedema coma.
Some of the nursing roles for hypothyroidism would include that we know that the patient needs to balance rest and activity and be provided with a warm environment, the diet, high in iodine, lifetime replacement drug therapy, most commonly with Synthroid. Good skincare, the nurse has to record intake and output and assess it for daily weight and fluid retention as well. We also have to instruct the client for follow-ups and regular TSH blood levels to be done. Teaching the client food diet to include high in fiber and low in calories, fat, and cholesterol. And also, we, the nurse, have to look for the potential of myxedema coma, which is usually treated with IV glucose, steroids, and Synthroid.
Other interventions include oxygenation, maintaining O2 sat of 90% or better, with ventilatory support if necessary. should not be sedated because it may cause respiratory distress. Prevention of hypertension, so we should, as nurses, should monitor the heart rate and blood pressure and observe for signs of shock like hypertension, decreased urine output, mental status changes, as well as observing for cognition with if the patient is lethargic or have poor attention span. These are indications of the hypothyroidism. Long term, as Trudianne said, a lifelong thyroid replacement therapy. We should, patient teaching, we can tell them that they should get an alert bracelet, that they should not take over-the-counter medications without speaking to their doctor, because the thyroid replacement therapy has a lot of interactions with different drugs. They should have a well-balanced diet with high fiber and fluids, because constipation is one of the manifestations of hypothyroidism. And the hormone should be taken on an empty stomach. Also within the patient teaching, they should check for their needs of sleep and their bowel movements, because that will indicate whether the therapy is working or if it's working too much, so then we'll be able to titrate the medication as time goes on so that it could be at the right level for the patient. So another treatment for the hyperthyroidism would be surgical, subtotal thyroidectomy or total thyroidectomy, and we have management for the operative process. So pre-operative interventions, we would, of course, discuss the procedure with the patient and entertain questions, make sure that the patient is fully aware of the process and understands the process. If they smoke, they should stop smoking a week before the surgery. If they're on blood thinners, they should hold the blood thinners for 4 to 5 days. They will get iodine therapy and anti-thyroid drugs to get the thyroid levels to a normal level prior to surgery. Of course, they shouldn't eat or drink after midnight, as most surgery. And prior to the surgery, we would teach them that after the surgery, they should, we practice with them, teaching them how to hold their neck when they're sitting or standing, so they can always have support on their neck with both hands. After post-surgery, the patient would be provided comfort, of course, and pain management. The head of the bed should be in the semi-Fowler position. And again, the pillows should be able to support the neck, and if the patient wants to sit or stand or lie down, they should always support their neck. We will assess their respiratory rate, rhythm, and depth, and we can also work with them on respiratory exercises, as we would do with most post-operative patients. And that's another reason why the high Fowlers is important. their ability to speak, noting the quality and tone of their voice, to assess for laryngeal nerve damage. We would also assess for damage to the parathyroid, so we would be assessing for hypokalemia with signs of paresthesia, muscle twitching, positive Chavaksnik or Truesdell signs, and we would also keep calcium glutamate and calcium chloride available in the event that we'll have to administer. And hemorrhage, we would check for hemorrhaging, and we would also check the incision site for drainage and to monitor that it's healing properly. Wound care.
Any questions?
I got a question. Because some of the meds that y'all need to be familiar with, I didn't hear. Okay? I didn't hear propranolol or Enderol. I didn't hear that medicine. I didn't hear hydrocortisone. Hydrocortisone, a steroid. I didn't hear that medication. I didn't hear the ranges for the labs. Every time you have a lab, how do you know if the lab is abnormal? What are the ranges? Okay? Yeah, I need to put that into your data bank. Something else I didn't hear. Did y'all mention the medicine PTU? Okay. Did y'all mention the medicine Tapazoil? Okay. These are the things that have a tendency to creep up on the exams. Okay. And on the NCLEX. That's why I'm pinging on y'all. Okay. But other than that, I think y'all did a very, very good job. It's thorough. It was detailed. All right. So give yourselves a pat on the back. Nice job.